Hello, everybody, and welcome to our presentation for Introduction to Gestalt Therapy. Uh, I will be presenting the very first part of understanding Gestalt Therapy. What are the key techniques? And we have four members in the group. I am Zakiya. I will be presenting the introduction, and then we have Fatima, who is going to do the key techniques for empty chair technique. Then we have Mahnoor, who is going to talk about guided fantasy and visualization. And then we have Yumna, the very last person presenting, who is going to talk about integration, and she's going to wrap up the Gestalt therapy presentation. So let's start with the Gestalt principles. So I will be explaining the principles for Gestalt therapy, and I will start talking about all the principles that we use in our therapy while doing Gestalt. So the very first core principle for Gestalt therapy is here and now. So in Gestalt therapy, we place a very strong emphasis on the present time. So rather than developing into what has happened in the past or how to speculate the future, we are very much in the present. We help our client to come in awareness of their current experiences, of their current moment, of right now and right here. So every time we are in therapy, we help client to come into the present, which is a very important aspect of our therapy. The second aspect or the second principle is awareness. Now, awareness is both, it's also a goal of the whole therapy and it's also an ongoing process. So, as someone taking therapy, when there is much more awareness of the client towards their sensations, their feelings, their actions, their thoughts, they start to recognize the pattern and they start understanding the choices they're making, right? And this is very important because awareness creates the space for helping them transform into into the version they want to be. The very next principle is responsibility. So in this principle, what happens is we help our clients to take ownership of their experience. So instead of a client blaming X, Y, Z or any external circumstances, uh, in our therapy, what we um, encourage our client is to take ownership of whatever has happened to them, or I would say empowering a client to see themselves uh, as someone actively participating in shaping their lives, I believe. Yes. So taking responsibility is a very, very crucial uh, responsibility in Gestalt therapy. When you start taking responsibility of what is happening, it starts uh, helping in our in one of the other principles, which is becoming whole, the wholeness. That's another principle we will talk about, but it really starts helping you understand that aspect. Uh, and after that is the dialogue. So in this principle, what happens is the relationship of the therapist and the client is very unique. Okay, so it's not just the therapist that's analyzing you or a client. It's a very mutual, authentic dialogue going to and fro, and this space becomes a very live, healing space where uh, healing occurs through honesty and through very much real-time feedback. So again, dialogue is a very important principle for Gestalt therapy. The next one is field theory. So over here, field theory reminds us that we can look at a person in isolation, right? So every individual exists with a larger context. It's very easy for a human to look at something happening in your life, just looking at one part of it, and then not understanding that we come or the client comes from a bigger picture, like for instance, the family, the culture, the environment, the history. So we have to understand the whole picture of where the client comes from or what part of the puzzle he is. So understanding the field really helps us understand how external factors shape our client. So my very favorite principle, Gestalt therapy, which I have kept for the last, is the wholeness. So when we talk about Gestalt therapy, we see a person as being a whole. It's not just their thoughts or their behavior, but it's the integration of your body, your mind, your emotion, and the whole aspect of healing is happening when there's no conflict in between any of these beings, and we're all working in harmony. So I hope you understand all of the six principles that I have explained today. Thank you. Now we're going to talk about why these techniques matter in Gestalt. So, as I have stated in the presentation, so these techniques are experiential tools, and they help uh, us to enhance the awareness of the client. So, like I've mentioned before, these techniques are also uh, these are the way this is the structure of helping to bring awareness for a client, and then these clients. Once they understand in the light of awareness, it is helpful for the client to go on with the healing. So the second point is they help clients process all sorts of unfinished business and whatever it is under the light of awareness, under accepting or feeling as a whole. Um, you start understanding how your choices were built and why did you start taking certain choices in your life. And then they, again, the next one is it facilitates the integration of the thoughts, emotions, and actions. We start understanding the whole of us, which is the best part of um, the therapy. Then what happens in these techniques, what I really love is that they are organically coming from the dialogues that are created to and from the client and the therapist. So there's nothing like it's not very what should I say? It's very organic in every form, more than forced upon the client, right? That's not the way Gestalt works. And the rest of the techniques are going to be, sorry, not techniques, but we're going to deep dive into more of it by the other members of the group. Thank you.
We'll discuss some Gestalt key techniques that will be helpful for the therapist to deal with the clients. It is one of the most iconic Gestalt technique. It is used to explore unresolved emotions, past relationships, unfinished businesses, grief, anger, internal conflicts. So, in empty chair technique, imagining a significant person from your past or a part of yourself sitting in an empty chair is very important. In this, the therapist places an empty chair in front of the client, and the client is invited to imagine that someone or something significant is sitting in that chair. The client then speaks to the chair as if they were speaking directly to that person or aspect of themselves. The client may switch between chairs, adopting the perspective of both parties in a conflict. This helps bring unconscious feelings and resolved issues into awareness. The two-tier technique is also known as the Gestalt dialogue. It is used when a client experiences internal conflict between two opposing parts of themselves. So, unlike the empty chair technique, it focuses on the external relationships or past issues. The two-tier technique is about resolving inner struggles. This technique helps client work through self-doubt, guilt, conflicting desires, self-criticism, or personal dilemmas. also another Gestalt technique in which the body language movements is very important. In this, the therapist asks the client to exaggerate double body language movements to make their meaning clearer. Repeatedly exaggerating a movement intensifies the feeling associated with that movement, leading to greater awareness of its inner meaning. So, exaggeration is an abstract concept like carrying others' burdens by physically carrying a heavy object. So, exaggeration is a dislike aspect of yourself to become aware of its opposite, the part you like about yourself. The practical applications of these three techniques. In the first, we discussed empty chair technique that represent an aspect of client personality, such as inner critic, inner child, or ideal self. For example, if we consider an example, if a client is struggling with the self-esteem, they might set up an empty chair for their inner critic and engage in a dialogue about the negative thoughts that arise. They can also move to the other chair to respond as their more compassionate or empowered self. Similarly, the two-chair technique represents the two aspects of personality. Unlike the empty chair, in this, the client speak as their fear about change. If I fail, then don't make enough money. In the other side, the client speak as their hope or dream. So these are the two sides. This is the two-chair technique. But I do be so much happy and fulfilled. This back and forth dialogue helps the client explore the full spectrum of their emotions and motivation. Exaggeration technique help individuals become aware of and integrate suppressed or denial parts of themselves by their body language. For example, these denial parts, often with the anxiety, are like shadow cells, aspect we try to hide. The therapists help to identify a specific behavior or trial or trait the individual suppresses. The therapist asks the individual to act out the opposite of their usual behavior. Benefits of Gestalt techniques. Firstly, with the empty chair technique, it provides a safe space to explore difficult emotions or relationships, promotes integration of conflicting part of the self, and encourages embodiment of the emotions and encourage client to express unspoken thoughts or feelings. Similarly, in the two-chair technique, it provides clarity or inner conflict, facilitates empathy by experiencing the other's perspective, and fosters emotional integration as clients come to understand both sides of their internal clock. And in the case of exaggeration, it makes clients aware of their internal conflicts and how they impact behavior, and greater self acceptance and integration of the denial aspect, promoting self personal growth.
So Fatma just explored some foundational techniques in Gestalt therapy. I will be looking at a few more that further highlight its experiential and holistic approach. The techniques that I will be talking about are guided fantasy and visualization, somatic work and body awareness, and dream work. So, guided fantasy and visualization in Gestalt therapy is a technique in which a therapist uses guided imagery techniques, fantasy to encourage clients to imagine situations such as what they would do in a certain situation or by projecting themselves into different roles, right? So these situations, they can be hypothetical or even an actual event that the client has experienced or gone through. In doing so, the therapist can help them focus on what they're thinking, doing, and sensing as they mentally experience this event. So the therapist is guiding the client through it. So what this does is that it basically increases client self-awareness of their thoughts and emotions, and it brings about closure to unfinished business. So unfinished business is any unresolved conflicts or emotions or feelings that the client has, is unable to let go of, or is unable to process them on their own. So, the outcome and therapeutic takeaway from this case study that I just presented is that Sarah reported having gone through an emotional breakthrough because she wasn't aware of this fear of rejection that she had suppressed for years. It promoted self-awareness, emotional integration, and inner dialogue because it allowed her the opportunity to connect with her inner child that um, was holding on to this fear of probably being rejected by a loved one if um, a need was expressed within the dynamic. So, guided fantasy, to conclude, can be a powerful tool to access deep hidden emotions that you have been suppressing um, for a long time, or emotions that you may not be aware of. So it helps to reveal those emotions, those feelings that have long been hidden or buried. Throughout therapy, a Gestalt therapist will concentrate on body language, which is considered a subtle indicator of intense emotions. When specific body language is noticed, the therapist may ask the client to exaggerate these moments or behaviors. This is thought to intensify the emotion attached to the behavior and highlight an inner meaning, right? So, Gestalt therapy, it views the body as a source of experiential data where unexpressed emotions often reside. So, for instance, if a client is talking about a very heavy emotion, the therapist may ask them to locate that emotion within the body. So, for example, they may ask, "What are you feeling in your chest right now as you talk about this?" This encourages the clients to shift attention inward and notice bodily signals. Uh, this allows them to be more present in the moment, present in the here and now, to promote self awareness, to reveal suppressed emotions. So, I will be explaining this technique with the help of a case study. So, Mark has chronic anxiety in social situations. And while discussing a past conflict, Mark touched his throat repeatedly. So the therapist prompted Mark to pause and notice what was happening in his throat right now. Mark reported a tightness and realized he often swallows his words instead of speaking up. The therapist invited him to exaggerate the gesture, which led to a dialogue with his silent self. The therapeutic benefit of using somatic work and body awareness in Gestalt therapy is immense because it connects the bodily cues to emotion patterns. It allows for a deeper insight into the client's emotional state, to probably the emotions that they've been suppressing for ages. It reveals unspoken needs, unmet needs, and it fosters a mind-body integration. So again, it promotes self-integration. The last technique that I'll be talking about that is used in Gestalt therapy is dream work. During a Gestalt session, dreams aren't interpreted but acted out. Different aspects of the individual can be found in different parts of a dream. So, becoming each part, the client becomes more aware of the many different sides of her or his personality. So, for instance, um, the client may be asked to be the thunderstorm in their dreams, and they may be asked, okay, fine, what would it say to you? So it promotes self-integration and allows the client to become more emotionally aware, um, and gain emotional insight into their deep hidden emotions. So to wrap up, the techniques we explored that were guided fantasy, body awareness, and dream work highlight the deeply experiential and integrative nature of Gestalt therapy. Each invites clients to move beyond words and access parts of themselves that are often nonverbal, symbolic, or embodied. These tools are not rigid formulas, they require presence, flexibility, and attunement to the client's process. When used thoughtfully, they foster self-discovery, emotional integration, and genuine transformation. As we move on to the final section, Yumna will be exploring how to apply these techniques ethically and effectively, keeping in mind client readiness and clinical context. Thank you so much.
So, when it comes to Gestalt therapy, there are a lot of considerations that the therapist needs to make for the purpose that his client can thrive. And so, the first category for that would be client readiness and suitability. And within that category, you have four things that a therapist must consider. The first one being how emotionally ready the client is, which essentially means, is the client able to tolerate present moment awareness and emotional activation. Then the therapist also needs to consider what we call ego strength, because some clients might need some degree of psychological stability to engage in this kind of experiential work. The third consideration is what we call contraindications. This is where we must use caution or refer out if clients present, let's say, with active psychosis or severe disassociation, or in cases where they might be suicidal, for example. And then the last thing that a therapist needs to really make sure with their client is their consent, which means that the therapist needs to clearly explain the nature of the gestalt work, the experiments that they want to do, how emotionally intense that experiment might be, with regards to body awareness. So you need to be mindful as a therapist that you're taking into account all of these four boxes. Right. Now, within therapist considerations, the other category that we need to talk about is then ethics and boundaries. So, when we talk about ethical experiments, the therapist needs to be careful that they use interventions that are purposeful, respectful, and of course, are in line with client growth. When we talk about boundaries, for example, we need to realize, or rather, the therapist needs to realize, that Gestalt is always relational, but it does require a very strong frame. So, for example, it needs to be mindful of the session time, their role clarity, and there needs to be physical boundaries as well. Another interesting or rather crucial element, under ethics and boundaries is cultural sensitivity, which means that the therapist needs to adapt their techniques with respect to the client's background and their comfort level. And then to kind of cinch this all together, the therapist also needs to be mindful of supervision and reflection, which essentially means that the therapist needs to realize that ongoing support is essential as a part of ethical and effective practice. Now, other than ethical experiments, or rather than other than ethics and client readiness, extra considerations also when it comes to gestalt. So for example, you need to handle resistance with care, because resistance is not really a problem that needs to be overcome, but it is actually a very helpful clue for the therapist, and it kind of can indicate your client's unmet needs, or their issues with boundaries. The other thing the therapist should keep in mind is what we call relational contact, because you as a therapist must foster what we call an I-thou connection, something that we talked about earlier in the presentation, which is being real, not performative, not being overly clinical. The other category that needs to be looked at is trauma sensitivity. So gestalt work, we know, can be quite intense. So pacing is very essential when you're working with people, with clients who have trauma histories. And of course, you also need to be focusing on the here and now. Consistently redirect the client to present moment to deepen their awareness. So these were considerations, and to kind of to bring this all
And to highlight all of this, let's look at a case example. So it says here that a therapist is working with Zara, a 27-year-old client who's struggling with low self-worth and difficulty expressing anger. So during one of their sessions, the therapist invites her to use what we call the empty chair technique to express her anger toward her absent father. Zara hesitates and says, "I don't think I'm ready for this." So the therapist gently insists, saying, "Trust the process. This will help you release what you're holding in." Zara reluctantly proceeds but becomes visibly overwhelmed and emotionally. So let's talk about what went wrong. So we can immediately see that there is a lack of respect. And what do we mean by lack of respect? So this is the therapist not respecting the fact that Zara is not ready, and also we didn't take her consent. The other thing is Zara's emotional safety was compromised. The third is that it's quite evident that the therapist projected her own or their own agenda instead of being mindful of the client's space, right? The other two things that sort of come to light with this also is that Zara was, offered absolutely no choice or agency. We could have said something like, we don't have to do this now. Let's find what feels safe for you. And instead, we kind of decided that no, we should go ahead. And the other thing is, we didn't spend any time exploring Zara's hesitation. We could have asked her something like, "What's coming up for you as you think about trying this?" And we kind of just went ahead with the experiment, with the technique, completely ignoring Zara's needs in the moment. To some limitations of Gestalt therapy, which is number one, it's not suitable for all clients, right? Especially clients who have severe mental illness. They may find Gestalt's unstructured nature, even more destabilizing. Also, one needs to be careful with Gestalt because it can be emotionally quite intense. It can be overwhelming for clients, especially those who lack emotional regulation. The other thing is that, Gestalt oftentimes it lacks the kind of structure which might not be very particularly appealing to some clients who do prefer something that might be more structured or directive. It also, number four, requires client readiness. This is very, very important. And the last, of course, is that it is highly therapist dependent. So it relies too much on, of course, the skill level of the therapist. It also depends on how present the therapist is, and how attuned they are with their client. So let's talk about the critique then. The critique, of course, is there's too much emphasis on the present, which is why sometimes you can overlook. There is potential to overlook historical or developmental roots of issues, right? There's also a cultural limitation because a lot of times clients that come from, let's say, a reserved culture, a reserved background, or a collectivist culture, they might find this, not so comfortable, the approaches of Gestalt. The other thing is there's a huge potential for power misuse, which means that, sometimes when you use slightly confrontational techniques, they might feel coercive, like you're persuading, or you feel very strongly about a particular technique, especially if you lack sensitivity as a therapist. The other thing is we don't really have a strong research base. So there's very little empirical evidence, compared to, let's say, other approaches like the CBT or psychodynamic approaches. So that's also a weakness. And of course, the techniques can be quite vague. They might seem quite subjective. They might seem quite inconsistent. But one cannot ignore the fact that Gestalt therapy, because it values awareness and authenticity and present moment awareness, it does empower clients, to take ownership of their choices and their emotional lives. And if the therapist is ethical, is skillful, it can offer a deep transformation and healing. So at the end of the day, success lies in honoring the client's space, story, and of course, capacity for growth. Thank you very much.